not recommending any adjustments to caseload at this time.
Okay, thank you. Public comment on the Medi-Cal caseload update. First witness.
Beth Capel, on behalf of Health Access California. We continue to think that the caseload to agree with LAO, that caseload may be high, that in fact the renewals which have been delayed as well as the improving economy will help to further shrink caseload. So we think this is higher than we would have anticipated given the underlying data. Thank you.
Great. Thank you. Next witness.
Michelle Stoll-Parvensky, Children's Defense Fund, and we would urge some close scrutiny of the estimates around the use of the Children's Health Insurance Program enhanced matching rate, and just appreciated the additional information here, but looking at the estimate of $650 million for the full year, if for 3/4 of a year, that would be about $480 million, and looking at the estimate being included in the May revise being less, would love more information about why that is lower. In addition, we continue to be concerned that these federal CHIP dollars are not being used and invested in children's health and are simply being absorbed into the general fund savings rather than using this opportunity to invest in children's health as that money was intended to be used. Thank you.
Thank you. Next witness, please.
Janice Canalan, on behalf of the California Children's Health Coverage Coalition, which includes the California Coverage and Health Initiatives, Children Now, United Way, PICO, and the Children's Partnership. We strongly believe that this federal CHIP bump funding should be reinvested in children's health, and we believe it should go to increasing reimbursement rates for primary care and dental care providers. Our reimbursement rates are some of the lowest in the country, 75% of the national average. We also believe that the state has a duty to enroll the remaining 160,000 children who are eligible but uninsured. We believe some of that CHIP money should be spent on reaching some of the hardest to reach children in our state, some of the poorest and likely children of color. Thank you.
Thank you very much. Any questions from members or comments? Okay, it's a recommendation that we approve this item. Okay, 3-0, recommendation on approval. Item 5, Medi-Cal County Administration augmentation.
Good morning, Jennifer Lopez, Department of Finance. To address the $150 million augmentation, this is the same amount that was provided to counties in 14-15 at governor's budget. The administration recognizes the challenges associated with the CalHER system and that county eligibility workers continue to have to process some Medi-Cal applications and renewals manually. However, the system has improved, and as you know, based on the 24-month roadmap, will continue to improve over time. Therefore, the administration provided an augmentation to counties consistent with what was provided in 14-15. To discuss item 2, the administration worked with the California Welfare Directors Association to gather information about the counties' what they experienced when implementing the Affordable Care Act. The administration gathered information from the SAW system, the county's consortia systems, MEDS, visited local county welfare offices, and we met with CWDA on several occasions. The administration decided to keep funding constant with what was provided in 14-15.
Could you tell me what counties the administration visited?
Yes, we visited Stanislaus County and Yuba County.
2. Oh.
2. And we visited Stanislaus twice.
Okay, I'm glad I asked that question. All right, thank you.
And then in Renee Malo, Department of Healthcare Services, Deputy Director. And in terms of the last item on the agenda for us to respond to in terms of the timeline, realistically, we anticipate that the new budgeting methodology will not be ready for use in the 16-17 budget. However, work efforts will certainly get underway this year in terms of preparing us towards the development. And we anticipate it's likely to be about 18 months out. Thank you.
Colleagues, nothing. Moving on to public comment.
Thank you, Madam Chair and members. Kathy Sunderling with the County Welfare Directors Association. I have to say that I am surprised to be standing before you here today expressing concern with the amount of the budget We, up to this point, have been working very closely with the administration. The $240 million that was the original ACA amount, the $150 million current year funding, were based on a model that we jointly vetted and have been working with for now, I think, going on 3 years. I just want to say before I make further comments that, as you know, as we've talked to you about and as you've heard from county workers, we have pushed counties past the breaking point. At the local level, counties have pushed their workers past the breaking point to hold the system together, to make sure that people can get their Medi-Cal. Despite the hindrance of CalHERS, which has been more of a hindrance many times than a help, and despite the caseloads being far greater than anybody ever anticipated. So the information that we provided between January and May to the administration regarding the workarounds that we're still experiencing, the workload backlog that counties are still facing to process things like hundreds of thousands of cases that have been batched into the system that we still have to go back and do work on. And we told you about that in the prior hearings. We provided all the information that was requested. And so we were very surprised and displeased, and we found it very unfortunate that just a few days before the May revise came out, we were actually presented with a proposed methodology that we'd never worked on with the administration, assuming that for some cases we could do the work of intake, case management, and an annual renewal for 14 minutes of eligibility worker time a year, 14 minutes for all 3 of those items. It is beyond logic how that could be done. No county worker in the state will tell you that they can do it for that amount of time, and you'll hear from some today, I'm sure, who will tell you, disavow anyone of that notion who believes it. Although visits were made to counties, we were told as we followed up with those counties that the individuals who visited came late, they left early, and in Yuba County, they did not want to look over the shoulder of a worker. So I don't know how you understand how a worker does their job if you don't even work with them to look to see what they're doing. So we appreciate the 240 being continued. Of course we appreciate the 150. It is not enough. 150 was never intended to be a full year. It's a half-year funding. Counties are overspending it, and they cannot sustain the level of effort that they're doing now with $150 million on top of the 240. It's not possible. We had requested that number be annualized to 300. It's another $48 million general fund. So the issue that we have is we can't sustain it and costs are going to go up. Costs for benefits for people who are not eligible, people who we cannot check to see if there's duplicate aid, people we cannot check CalHERS to see if CalHERS has done it wrong. We have to look at every case today to see did CalHERS do it right, because it often does it wrong. It doesn't do the income right, it creates duplicate cases, and those are all capitation payments that are going to be made multiple times. We will not be able to do the renewals in a timely manner. So we are, without this funding, not going to be able to do the work that you expect of us and that the administration expects of us to be able to do this program. And when we saw this happen years ago, about a decade ago, costs went up hundreds of millions of dollars for underfunding of tens of millions of dollars. We are efficient at program integrity, and we are efficient at making sure that only people who are eligible are on the program. We also don't think that 18 months to do the budget methodology is feasible at this point. We were asked for information and data over the last 2 weeks that we could have only provided if a budget methodology workload study had been done. We agreed with the administration that the amount of work that was going on locally was so high that we couldn't possibly do the workload study right now because they could never afford to fund the amount of work. Now we have to get it going. We're urging you to adopt trailer bill language to require that it get going. The funding is in the current year budget to do that study and to provide 2 staff for DHCS to do that. So we request that you do that as well and get that study going so we can get folks down there with the stopwatches if that's what it's going to take to prove to the administration that this is the kind of workload that we're under. Thank you for your time. We appreciate your consideration.
Can I ask you a question? Did you provide any input into the administration as to which counties perhaps they should visit, particularly since these visits we're going to lead to an ultimate concept around workload processes and timing?
We actually did work with the Department of Finance to identify the 2 counties. They needed to be, within a driving distance, large enough and have enough going on, which is really not all that hard to find right now, given the tremendous number of workarounds that are going on. So we helped connect them with Stanislaus and Yuba counties, yes. However, I will say that we had no idea that these 2 county visits, again, which based on our conversations with the county directors there, sounded wholly inadequate for driving a new budget methodology and certainly driving anyone's belief that what was seen in the amount of time that was spent in 2 counties should result in the amount of money that's been provided. I'll just say.
Thank you.
Thank you, Senator.
Next witness.
Good morning, Senators. Tia Orr on behalf of the Service Employees International Union. I will not be redundant from my colleague Kathy Centerling's points, but we too are equally as surprised, somewhat slighted by the proposal by the administration. SEIU has worked in very good partnership, we thought, with the administration on trying to figure out the needs of the county. We have workers that are working overtime every single day doing their jobs to make sure that they get folks enrolled. We did not anticipate any type of underfunding to the counties to do this job. I would just say a couple of things to reiterate. I think these numbers are uninformed. I think had they talked to any of our workers in any of these counties, and we have some here today, they would tell you that 14 minutes is only a dream, nowhere close of a reality. The system problems, I think, inform the fact that we can't do a workload study, so we would think that they would also inform the fact that 14 minutes is not a realistic number, and it's far-fetched from the reality of our workers' experience. Again, workers are here to tell you their experience, Mr. Monning. We have workers from your district, Senator Mitchell. We have workers from your district as well that can tell you about their experience in their county. I would just like to tell you one thing. In Santa Clara specifically, we have about 100,000 cases over what our labor contract says. So on SEIU's part, we're doing our share. We know our contract is not being abided by. It's okay. We're going to keep on moving and make sure we get people enrolled. But those are the sacrifices that we're making and our workers are making to make sure that this works properly. $150 million short is in no way going to provide general fund savings. If anything, we're going to have people on the rolls getting coverage that your last line of defense, your workers at your counties, are not going to be able to double check and make sure are eligible.
Could you repeat to me one more time what the eligibility determination, the 14 minutes is? What's the work you're doing?
It's
within the 14 minutes?
eligibility, it's continuing cases, it's the whole gamut.
So it's
all year.
Everything that I would be coming in for.
Questions about the notices that you worked on in 1341 last year, all the stuff that we're doing, all the questions that they have. We spend hours with clients.
Right.
If anything, just to explain the program, tell them where that they can go, what doctors are eligible. It's unrealistic, and we're serving the public. Workers' lives, of course, are going to be impacted. That's the least of our concern. Our concern is clients are not going to be able to be helped, and the integrity of the program is going to be jeopardized because your last line of defense is not there to make sure that it has integrity.
Does the administration have an expectation on any of the other public benefit program around a time frame around interaction between the client and whoever's assisting them?
I do want to point out, Jennifer Lopez, Department of Finance, that the 14 minutes was not used to come to the $390 million augmentation.
Okay.
That is being referenced.
Okay.
I'm not aware on the other programs, so I could not speak to that. I would have to have you speak with DSS.
Okay. I was just curious because as I ran the largest child care subsidy organization, we had a contract with the county, and the lion's share of my 500 employees did kind of intake kind of work. As I'm thinking about my own contracts with CDE and the county, that wasn't part of my own budgeting process. So we had workflows and systems, but when we had people come in for annual research or whatever, we didn't, we were just doing childcare. We weren't doing the kinds of, that's why I asked you what. I'm not sure how my workers could have done it in 14 minutes. Okay, thank you, and thank you for that clarification.
Ma'am, it's just a request that we have a workload study. We've pushed it off in fairness and trying to work in partnership. It's obvious now with this proposal that a workload study is mandatory and needs to happen right away so that we can all be fully informed of what the time per case is.
Right, thank you. Next witness.
Roseanne Berthrana-Rechka, Program Coordinator, Medi-Cal Program Coordinator, County of Santa Clara. I really wish that you would have come to Mr. Monning's, Senator Monning's district and looked at what we have going on there. At recent CalHERS hearing, the administration acknowledged that they felt that they had system stability now and that they were working on programmatic stability, which that means to me that the system doesn't crash now, but the results are uncertain. That's what that's saying to me. And they coined it as being the maturity level of CalHERS as being that of a teenager. So if you would understand the environment that we're working in, because our SAW system has to interface with that system to get us eligibility results. There's no unique identifier in the CalHERS system. So clients or people assisting clients can do multiple applications. In 1 month in Santa Clara County, we received 10,777 duplicate applications. In order to sort through those duplicate applications, it takes about 60 minutes to get all the duplicates together and look at each one individually. We have a whole team working on that just to begin to start to do the work. in order to get our caseloads ready for what is called the happy path, which means that they run against the federal hub and come back without minimal amount of work by a worker, it's taking between 2.5 and 7.5 hours to merge those cases, transition those cases, link those cases, all stuff that's way in the weeds for you guys. But the assumptions used to come up with the money allocated to the counties are flawed because they don't really understand the world we live in. And in the small amount of time here, we can't explain it to you. We would invite and encourage you to please work with counties and see the realities going on there, because as Ms. Orr stated, what will happen is that the state of California has decided that in order to meet the 45-day requirement, that they're just going to batch people over to meds and wait for the counties to figure out if those people are actually eligible. So the the backlog just keeps getting higher and higher and higher while these people are on services maybe they're eligible for, maybe they're not eligible for. Thank you.
Thank you. Next witness.
Good morning, Madam Chair and members. Farah McDade-Ting from the California State Association of Counties. I want to associate my comments, of course, with Ms. Sunderline McDonald of the County Welfare Directors Association in that we believe the $150 million is grossly inadequate. I want to point out that counties are still working with, as the worker just mentioned, the backlog and duplicates. We still have significant issues with the CalHERS system, as anybody who's ever been around a teenager would know. Very difficult, and we implore you to consider the $300 million request as well as the trailer bill language to begin the work study immediately so that we have hard data on what the funding should actually be. Thank you for your time.
Thank you. Appreciate it. Next witness.
Good afternoon, Madam Chair, members. Martha Guerrero, representing the Los Angeles County Board of Supervisors. Very disappointed with what came out in the budget. It is underfunding what we truly need to accomplish in Los Angeles County. Our eligibility workers are at their wits' end trying to fix the back end, the system that CalHERS has created. We need to address this, and we need to address this now. And our board has sent a letter, 5-signature letter, to Governor Brown asking for this to be addressed. So we urge you to take a close look at this and address it now. Thank you.
Thank you. Next witness.
Good morning. My name is Ray Cadena. I'm with the County of Los Angeles. I'm from Senator Mitchell's district. We have quite a few issues going on with Medi-Cal and CalHERS, and it doesn't matter which. If it has a different segment attached to it, any changes we make to any part of the case, we have to go back in and reevaluate every single person on the case for Medi-Cal, because it will terminate Medi-Cal services for any one of the participants. We also have issues where undocumented people are being given full scope Medi-Cal due to system errors, and it's not found until we, the eligibility workers, review the cases. Because a lot of CalHERS cases are coming in self-attested. They just have to tell you, okay, I'm a U.S. citizen, but there's no documentation provided until we get the case. And when we start evaluating everything, we find all these errors. We also have quite a few duplicate cases where if somebody's told this person doesn't qualify, they'll call CalHERS and they'll reapply and give different information. Then we get all these cases and we try to make one case out of it.
And it's always my concern in those instances that those cases aren't perceived as fraud, but as an individual who's getting different information, and so they're applying based on kind of different information they've received.
Yes, and also the redeterminations, when we're doing redeterminations on a Medi-Cal case. I've had some that have taken me up to 2 hours because every single person has to be reevaluated.
Right.
And we have we have mixed households. We have some people that are 25, some people 18. We have some, and or they're paid cash.
Right.
And all that has to be taken into effect and reevaluated.
Right. So. Thank you very much for your testimony. Appreciate it. Next witness, please.
Good morning. My name is Carlos Tovar, And I think you guys need a bigger boat. You guys need to come to LA and see what's going on there. I'm from Cudahy, I'm the shop steward there. And we need to reevaluate the cost. We need more workers because we're not, it's hard to work with what we have to service our people there in Cudahy, and it's a big mess going on right now without extra funding.
Got it.
Thank you.
Thank you very much. Next witness.
Linda Way with Western Center on Law and Poverty. We're not experts on the number, but we are aware of the workload issues county workers are facing and the processing times and the backlog to process Medi-Cal applications and renewals. We think it's important that determinations be made in a timely manner.
Thank you. Next witness.
Tam Ma with Health Access California. I want to echo the comments of the previous speakers. Also wanted to acknowledge the tremendous work that county workers have done to process applications and renewals in light of all the significant technological challenges that they are working with. And we too agree that with Western Center that we're not experts on the amount of resources that are needed, but we really appreciate the committee's thoughtful look at this issue and making sure that the counties do have the adequate resources to do the work. Thank you.
Thank you very much. It is the committee's recommendation that we hold this hot potato issue open. Whether it can be resolved by Thursday, I don't know, but we're going to hold it open anyway. All right, thank you all. Appreciate it. Moving on.
Sure. So, Mary Cantwell, DH.
Item number 6, the Medi-Cal impact of President's executive order.
Sure. So first, as noted in the agenda, we did revise the original projection that was in the original May revise, and appreciate that it was already included in the agenda today. So as we've previously discussed, the current eligibility policy in California provides for full scope Medi-Cal coverage for certain categories of immigrants, and the governor's May revise estimates the budget year and ongoing increases to caseload and costs due to the president's immigration order. The department based our estimates on two main sources of information. First, information we have about the population already covered in Medi-Cal through our limited scope programs, as well as information from the Migration Policy Institute. First, based on our estimated current limited scope populations and using information from MPI on eligibility for the President's action and historical take-up and approval rates, we assume 156,000 of our current limited scope population would be approved for DAPA or DACA, and that 50% of that population would enroll in full scope Medi-Cal. Second, based on the information from MPI broadly on eligibility and likely take-up and approval for DACA and DAPA of the total undocumented population, we assume about 238,000 people would be eligible for Medi-Cal, and that 10% of that population would enroll in full scope Medi-Cal. So that is a total of just over 101,000 individuals enrolling at full implementation. We assume enrollment starts in October of this year and that there would be a 12-month phase-in. In total, we assume for budget year that the total cost of coverage for this population is $70 million total funds, but we are currently spending $29 million on limited scope services, so the net cost is $41.5 million total funds, or $33.2 million general fund. For the annual cost, the total funds after offsetting for the limited scope cost is $206 million total funds and $165 million general fund.
Any questions? Finance, LAO.
We find that there's significant uncertainty as to if and when the executive actions may be implemented. It's not clear that the actions will be implemented such that enrollment into Medi-Cal could begin in October of 2015. Therefore, we recommend that the legislature weigh the trade-offs of using the proposed resources for this purpose, as it's certainly possible that there may be costs associated with the executive actions in the budget year. However, given the uncertainty, this also prevents these resources from being used for other legislative priorities. Further, if the funding is included, we recommend that the funding be reduced from the amount assumed in the governor's budget, because we find that it's likely to take longer than the assumed 12-month phase-in period. And we find that the cost could be reduced as much as 50%, which would result in savings of, based on the new estimate from the department, $25 million general fund compared to what is assumed in the governor's proposal.
Finance. Or
May I respond to the LAO? Thank you. So certainly, obviously this is all based on estimates. I would like to note that we did assume that only 10% of the population not currently enrolled who could likely be eligible would take up, and only 50% of the population who's currently in limited scope would take up.
Got it. Got it. All right, public comment.
Beth Capel on behalf of Health Access California. Our view is that the department's estimates are both too high and too low. That is, they are too high in that once the president's action is in force, it will be 4 to 6 months before people can obtain deferred action, which would mean it would not be in effect, even if tomorrow the courts decided otherwise, which we would be thrilled by. It would not be in effect until somewhat later in the year. Although we do anticipate that the courts will eventually uphold the president's action, because as we previously discussed, presidents going back to President Washington have had the authority to enforce the law. We don't know exactly when that will occur or if it will occur in the budget year. However, the rest of their estimates are far too low. And that is true at literally every point along the way. The current take-up among DACA young adults is closer to 60%. Those who apply for deferred action succeed at 88%, not 81%. And most vitally, because they relied on Migration Policy Institute rather than the on-point study done by the University of California at Los Angeles and at Berkeley, they misestimate the number of undocumented persons in this income level at about 44%, when in fact it's closer to 2/3. Not surprisingly, these are people who don't have work permits. So they substantially underestimate the number likely to shift from limited scope to full scope. It also, and the final error in estimation, the notion that people, when they apply for renewal, would not shift at that time to full scope if they had deferred action, seems to us counterintuitive. So a 50% take up of the, there are like 6 factors here, also seems to us low. So for the budget year, we anticipate that the costs will be modest. This matters a lot for the out years and also for the implications for other pending measures. We do appreciate that the administration has now acknowledged that there are current spending on restricted scope and the 62% that we have as a number of the offsetting costs. And we also appreciate the administration's acknowledgement that existing state and federal law does compel them to cover folks once they obtain deferred action. Thank you.
Thank you. Next witness.
Linda Way with Western Center on Law and Poverty. The proposal makes positive steps in including immigrants granted deferred action under the President's executive order in its Medi-Cal estimates. The proposal does not expand Medi-Cal eligibility, but rightly includes estimates of individuals who would be granted under current state law.
Thank you. Next witness.
Kimberly Chen with the California Pan-Ethnic Health Network. Want to appreciate the revises inclusion of newly eligible folks under DACA-DAPA, and want to echo the comments of the previous speakers.
Thank you very much. And we're going to hold this item open. Moving on to item 7, the Coordinated Care Initiative, Multi-Purpose Senior Services Transition Timeline.
Certainly. So over the course of the last several months, concerns have been raised about the timeline for the full integration of MSSP into managed care. So this proposal is recognizing those concerns and is proposing to extend the timeline as requested by the MSSP providers to the end of December 2017. But if the providers and the plans both agree and both meet readiness, it could occur sooner with notification to the legislature.
LAO? Finance, members, public comment.